Ooh, I think I'm good. I think I got it. I think we're recording. Yes. And so that's a really great place for you guys to go back and get some information. If you haven't been able to join us on our webinars, we've covered a lot of really good topics, mostly concerning type 2 diabetes. Not always. There's been some fun, trendy things that we've talked about as well. But make sure you check those out. And if you're not sure how to find us, you can go to bartonwebinar.com, and that'll give you a link to our YouTube channel so that you can see all of those. Okay, so one more thing that I'm going to do here is I'm going to make sure I go live on Facebook. So this is going to take me just a second. Those of you who are on Facebook, we have a favor to ask. Can you share this while we are live? We know that there are a lot of people looking for this information that want to know how to get healthy, that maybe aren't sure how. And we would love for you guys to share this, even on your own personal Facebook pages, because this is a free webinar. We want more people to be able to be a part of this, to learn with us, to grow with us. And, you can help us to help other people. So please share this. If you guys could do that, I'm going to share it here on Facebook. I have to stop talking in order to share it. So hold on one second. I'm sharing this on our Barton Publishing page. If you can find that on Facebook, if you're able to do that. Some of you are on your phone and you're not going to be able to do two things at once, but even after the webinar, if you want to share it, that'd be great. Okay, I think it's working. Let's see. Say hi if you're hopping on. I can see we have a lot of participants jumping on, which is awesome. So say hello. Let us know where you are from. You're probably not used to seeing my face here. You may see my name in the background typically on these webinars, but I'm Leslie, and I have been a part of the Barton Publishing team for quite some time. You just don't usually see me here. You usually see Joe, and he looks, he doesn't have quite as much hair as I do, but okay. I think I'm almost ready. Hold on. I got to get this on Facebook. I'm just going to say, join us live. All right, ready? It's posted to Facebook. We should be live here. Just kidding. Hold on. Talking and typing is hard, guys. I'm sorry. Okay, now can I hit go live? Maybe?
It's like walking and chewing bubble gum at the same time.
Well, yeah, sure.
Well, now we're live on Facebook.
Okay. It says it's working. Yes. Oh, you guys. So many things that happen on the background here. Let's see. Okay, so we have Walt is here. Hello, Walt. Sir William, hello from Bill in Toronto, Canada. Awesome. Hello. Skip is here. How are you, Skip? Matt from Illinois. We have Tim from Buffalo, Minnesota. You know what, Tim? It's cold. It's cold. And we're talking about cold therapy today. That is our topic. And so
yeah.
I'm really excited to talk about this because I'm kind of like, I would like to meet some more people who live in cold temperatures who are all for this, because I feel like I already have cold therapy every single day when I wake up and go outside. So I'm excited to learn a little bit more about this. Patrick is on, checking in from Apache Junction. Yes. Hi, Patrick. You guys, I'm so excited to see so many of you. Bob is here. Yes. You guys, okay, so this is the great thing about our webinars. For those of you who have never been a part of our webinars, we do this each week. Now, our main focus is type 2 diabetes, but we do talk about some other things as well. We have the honor and privilege of having Dr. Scott Saunders with us. And you know what? I should read some information about him because we don't always tell you this stuff. So let me see. He graduated from UCLA Medical School, but he's now in private practice as a functional medicine doctor in Southern California. He has helped thousands of people with many different illnesses, including my own personal family. But he has a passion and a real focus for type 2 diabetes. And so that is what we focus on these webinars. Today, we are going to be talking about that, but we're also going to talk about cold therapy. So I am excited about this topic. This is actually something that Joe Barton, who is our founder of Barton Publishing, wanted to talk about because he's been experimenting with this, learning some things. And then, of course, he's not here today, right? So he's been filling us in a little bit, but we're going to talk about this, kind of from the medical standpoint too, where Dr. Saunders maybe has seen some of these things. So Let's see, what else can I tell you? Last week we talked about our best remedies for nerve pain. So if you have not watched that and you would like to learn more about that, you can still do that. It's on YouTube. You can also go to bartonwebinar.com and you will find our most recent webinar. So make sure you bookmark that site. That's where you're going to get a lot of information. So I think with that, we're probably ready to get started. One more thing I'm going to do, I'm going to read our disclaimer. This video content has been made available for informational and educational purposes only. It is not intended to be a substitute for professional medical advice, diagnoses, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen here. We have to say that. It's very professional, but we have to say
But
that.
also it's good advice, because what we talk about is general cases and general principles, and people have different applications, And I noticed last time we had a question about Nervala. We were talking about Nervala. Does it repair the vagus nerve? And the vagus nerve is an entirely different system. It's not like a peripheral nerve that you see in diabetes with peripheral neuropathy. So, if the vagus nerve is damaged by a lack of vitamin B12, yes, it will, or or B vitamins, B1 um, and alpha lipoic acid. It will help, but as a general rule, you can apply it, the information generally, but not necessarily specifically to every individual.
Sure. Okay, that's good.
No.
Okay, let's get started. Again, lots of people hopping on. I'm so excited to see all of you. Can you guys let us know where you're tuning in from? And on Facebook as well, let us know. Even if you're watching the replay, we still like to know where you guys are hopping on from. So just go ahead and type your name, where you're from. We love to know who's all seeing us. So before we begin, I would love for Dr. Saunders to kind of give us an overview of type 2 diabetes. Maybe there are some people who've been recently diagnosed who are hopping on and there's some confusion exactly about what's happening, or maybe you really would like to help a loved one. Let's just talk about what type 2 is and what is type 1? What is the difference?
Oh, that's a great question. Okay, we dealt with this a long time ago, but it's been a long time. The difference between type 1 and type 2 is like they are opposite diseases at opposite ends of the spectrum. And it's really unfortunate that we use the same name, diabetes, to indicate two very different diseases. And the reason that's important is because type 1 diabetes is a disease of not enough. The pancreas doesn't make enough insulin. You can't get enough energy into the cells. People who died before we had insulin shots, people died of type 1 diabetes, and what they died was from starvation. They died from starvation. They could eat as much as they want, and they would still die from starvation because that insulin's required to get energy into cells. So the cells would just shrink and die and shrivel and die, and they couldn't get enough energy, and the mitochondria would go away, and people would die of starvation. They'd just get skinnier and skinnier and skinnier until they died. And with insulin now, we can inject insulin, get that energy into the cells, and fatten them up, and make people actually function pretty normally, even if their pancreas doesn't make any insulin. So that's why they do insulin injections in type 1 diabetes, because they don't have enough. Now, type 2 diabetes, we like to call it type 2, just because it's a totally different disease than what was first characterized in the early 1900s. And that is, it is a disease of too much. You have way too much insulin. So insulin is causing your cells to bring in sugar and bring in sugar and bring in sugar. And the cells fill up with sugar. They have too much sugar. So you have too much insulin, too much sugar. And then the cells go, whoa, we have too much, and they block all the insulin. So now your insulin doesn't work. so the blood sugar starts going up because the insulin isn't working. So that's where they connect. You have this crossing of type 1 diabetes and type 2 both get high blood sugar, and they go, oh, that must be the same disease. But it's totally the opposite. So that's why in type 1 diabetes, you have to inject insulin. You just have to. You know, you don't go, oh, I'm not going to need insulin anymore. As long as your pancreas is not working, you need insulin. In type 2 diabetes, however, it's almost always an oversupply of insulin, in which case you do not want insulin. Insulin will just cause worsening of the problems. It causes the cells to be stuffed with more fat, more sugar, and more glycogen, and they get more toxic, and then they start dying. Especially liver cells die when that happens. So insulin is not the right treatment for type 2, but it is the right treatment for type 1. So we have these two very different diseases and so if you look at the what we wrote on the diabetes reversal or the diabetes solution kit, mostly only applies to type 2 diabetes. So type 2 is the key. And because it's too much, we start out with a very limited number of carbohydrates in your diet. So that's the program is to get all that down so that you can start using what's in your cells. So you can start using all that sugar and glycogen that's been stored in your cells for years. And then once that happens, then the cells open up again. They start living again. They start using insulin again. You become less insulin resistant, and you can function normally, even though you still always have that propensity, at least to type 2.
Okay, Skip just asked, what is an example of an oversupply of insulin?
Okay, so I do insulin testing. And whenever you have insulin resistance, you have an oversupply of insulin. And so now, if you go to your doctor, you can ask them to do an insulin resistance test. And they will tell you if you have an oversupply of insulin. And all they do is they tell you if you're above 1, then you have an oversupply of insulin because you have insulin resistance. And that's really just a marker. It's not the real thing. But when I do insulin testing, I've had people a normal fasting insulin level would be 5, 6, 7, somewhere in there, 3, 4, 5, between 3 and 7 level of insulin. I've seen people in the 20s, 50s. I had one with 150. Insulin was 150, was 100 times the upper limit of normal, almost. So that's clearly an oversupply of insulin. And so if your doctor hasn't done insulin testing, you won't know if you have too much insulin or not.
Wow. Okay, guys, if you have not said hello, please say hi. Let us know where you're tuning in from. We're here with Dr. Saunders. We are talking about type 2 diabetes, but then also cold therapy, which we haven't even gotten into yet. So some of you are just hopping on. If you're on the Facebook page, say hello there as well, even if you're watching the replay. Why is there not a home test for insulin, Skip says?
Because it can happen. It's not hard. It's easy to do. Insulin is a protein hormone that could be tested. However, because the current thinking in medicine is to not do insulin testing, because the control that they're looking at is blood sugar control. So they only test for blood sugar, and then hemoglobin A1C, which is the long-term blood sugar. And so it's really more of a logistical thing that doctors wouldn't use a home test. They wouldn't recommend it. And so nobody's developed it, but it could easily be developed. You could have a little machine like your ketone machine or your blood sugar machine that would test for insulin. But that really isn't that necessary. If you test once and you say, oh, I'm insulin resistant, wow, I have really high insulin, and then you do the program and you retest, 3 months later, 6 months later, that's adequate. It's not something that you have to check every day.
Okay. I did post a link. If you guys want to scroll up in the chat, you can see bartonwebinar.com. That'll take you to a lot of the information that we've been talking about today. It'll give you a link to our diabetes solution kit, which Dr. Saunders has put together with our team at Barton Publishing. Helps you to figure out a way to, what's the best way to say it? Manage. I don't want to say the wrong words here, but to take you on this journey to combat type 2 diabetes. There's food plans, grocery lists, talks to you about what type 2 diabetes is, a little bit more about even what Dr. Saunders just shared now. And so we do have that information available. We have the Diabetes Solution Kit in a digital format. You can purchase the book. Also on that site, you'll see the link to all of our past webinars that we've been doing. We've been doing this every Tuesday, and so we have a lot of good information. So make sure you go and check that out. There is also a link to all of our supplements. So do check that out as well. Okay, we have a couple of other questions that are coming in, and I do want to get to those, but let's go ahead and start with our topic for today. Cold therapy. So now this is something that is kind of trendy, and I'm really just learning a little bit about. Joe Barton, our founder, has talked about this. He has been doing some reading about, I think he has one of, is it Wim Hof's books? I can't remember which one it is, but he's been reading about how cold therapy can really change your day, change your a lot of things. And so we wanted to hear from you, Dr. Saunders, if you're seeing, is this just some fad? Is this a real thing? What could cold therapy honestly be helping?
Okay, that's a great question. In fact, there was a lead-in question, I think it was Skip, that asked about the vagus nerve, about does Nervala help the vagus nerve? And the vagus nerve is the sympathetic nervous system. And the sympathetic nervous system is what controls all of the things in your body that you don't specifically control. So it's like your temperature, your blood pressure, your heart rate, the function of your pancreas and your liver and your intestines are all have this control, this direct wired control from the brain to through the vagus nerve and into all of your organs and the autonomic nervous system. So when people have problems with the vagus nerve, sometimes like they'll get ulcers, and they used to in the old days when people would get chronic ulcers, recurrent ulcers, they would cut the vagus nerve so that the brain would no longer tell the stomach to make acid. And that worked for a while, but actually the vagus nerve eventually heals, and then they end up getting the ulcers back again. So they don't do that anymore. But a long time ago, that was a treatment. That was a real thing. They would actually cut the vagus nerve. In rats who were genetically predisposed to diabetes, they cut the vagus nerve, and the pancreas just started working again. And not like gradually started working, but instantly. As soon as they cut the nerve, boom, their pancreas is working perfectly, and their blood sugar's normal and everything, and they don't need insulin anymore. So the vagus nerve is really important. It controls all of the stuff that you don't have to think about all the time. And so the cold therapy is really about control of the sympathetic nervous system. So your heart rate, your temperature, your blood pressure, and all of the functioning of the organs in your body. We don't normally have conscious control, but I don't know if any of you have ever read about like the yogis in Tibet that can raise their pressure and lower their pressure and raise their temperature and lower their temperature, all that kind of stuff. Just with their own conscious thinking or meditation, they could do that. We can gain and learn to gain control over the sympathetic system. So what Wim Hof has done, he's a Dutch man, very interesting fellow, who holds the record for swimming under the ice in like a Speedo. He didn't even have a wetsuit on. He's like wearing nothing. And he holds the longest distance swimming under ice. And that's why they call him the Iceman, or one reason. He says that he can train people how to do this in 4 days. And he can train them to control their autonomic nervous system. And he has so much control over his autonomic nervous system that he got a shot one time. he got a shot of something called endotoxin. Endotoxin is what people die from when they get a staph infection. So if you get an overwhelming staph sepsis infection, the endotoxin causes cardiovascular collapse, where your blood vessels all dilate, your blood runs out of your head, and you get shock and die. And so he got an injection of endotoxin in his body, and his blood pressure and temperature and everything was just normal, normal, normal. He didn't even get a fever, nothing, just stayed perfectly straight because he had control over that autonomic nervous system. So in the case of diabetes, a lot of the things that are going on, a lot of the problems are associated with the nervous system. That's what neuropathy in your feet, and that's where you notice it, mostly in your feet. But neuropathy of all kinds, even the brain. We talked once about how type 3 diabetes is dementia, or a lot of what we call vascular or metabolic dementia is being now called type 3 diabetes, because the metabolism has so much effect on the function of the nervous system. Well, that affects everything. If your brain's not working right, then your autonomic nervous system doesn't work right, your blood pressure doesn't work right, you lose the ability to respond to things properly, changes, and that's a lot of the problems that people have are associated with the nervous system dysfunction. So even though we talk sometimes or mostly about the biochemistry of it and say, okay, you can take this supplement and that supplement. And
oh, you're muted. That happens sometimes.
Okay, sorry. Okay. All right, back on?
Yep.
Okay. That's all biochemistry. So besides the biochemistry, though, there are physical ways and mental ways of controlling, because the brain controls everything in your body. Every inch of your body, the blood vessels, the circulation is controlled by your brain on a constant basis. Like in every little bit, like your brain can shut off the blood supply to your fingers. It's called Raynaud's disease. And some people have had to have amputations of their fingers just because they get necrosis, because the brain shut off the blood supply. You ever been out when it's really cold and your fingers turn white or blue? Well, that's the brain shutting off the blood supply, going, well, I don't want to get that cold. It's too cold there. I don't want the blood to come back cold. I gotta conserve heat. So the brain controls all of this. So if you can gain control over it, that's where the cold therapy comes in. So when you do, it's more than just then taking ice baths, and he does recommend ice baths, but it's more than that. There's actually a breathing technique associated with it, if you've ever done like a yoga breathing. And that is a very important part of it, because that changes the pH of your blood. You're actually you're breathing really hard, you get rid of carbon dioxide, and the pH of your blood goes up. And then you hold your breath and the pH of your blood goes down. And so you get variations. So can I tell you how it works?
Yes, we want to know.
Okay. All biological systems require contrast. It's not enough to have, we want homeostasis. We want to go from our heated car to our heated house, and then in the summer from our air-conditioned house to our air-conditioned car to our air-conditioned office. We want the temperature to be 70 degrees all the time, and that makes us feel good because we always have that 70-degree temperature. But our body system, our nervous system needs contrast. We need hot and cold. We need that contrast in order to get a set point of where things are supposed to be and how to regulate the body. So regulation stops happening when we have a constant supply of something. And that's true with anything. So let me give you diabetes for an example. When your blood sugar is high over a long period of time, then you lose the ability to bring sugar into cells. And that includes nerve cells. So the irony of the whole thing about the type 2, type 3 diabetes, the dementia and neuropathy is that your nerve cells are dying from a lack of sugar, and your blood is filled with sugar. You probably have, 2 to 3 times the amount of sugar you need in your blood, and it's constantly that high. And all your systems for being able to get the sugar into the cells have been downregulated to the point where your brain is starving for sugar in the midst of all this sugar. That's the way biological systems work. We need the contrast. So what we were always told, you should never have hypoglycemia. Well, actually, it's probably pretty good to have some hypoglycemia. You have to be careful with type 1. If you get too much insulin and you get, in the 20s, that's not good for you. But if you're getting in the 70s and 60s and you're feeling really weak and tired and you get a headache, that's actually helpful. They actually did a study on rats with this, and they found that after 3 days of hypoglycemia, on the fourth day, the rats were like running around, having a good time, and their blood sugar was 40. And they did a biopsy of the blood-brain barrier, and they found that they had 10 times the glucose transport proteins to get the sugar out of the blood and into the brain. So that contrast was required to upregulate those glucose transport proteins. So if you have type 2, don't worry so much about hypoglycemia. We need the contrast. We need that difference, which is how the Wim Hof method works. The Wim Hof method works by giving you contrast both in pH, that's the breathing part, and then in temperature. And when you consciously control your temperature in spite of what the ambient temperature is, whether it's really cold, for example, or really hot, and you're controlling your pH by your breathing technique, then that allows you to start gaining control over the autonomic nervous system.
Wow, very interesting. I'm also finding a lot of correlation. I think in a lot of our webinars it's come up where we are meant for feast and famine in all areas, like you're saying. And so if you guys have not checked or listened to the webinar that we did about our 610 reset, I believe the title of the webinar is Anabolic and Metabolic. We kind of dig into this a little bit more into eating and fasting and how our body works best that way. And so I just find so many correlations in all of our webinars about how we need both. And I also feel like you're confirming that I should keep living in South Dakota, because it's real hot and then it's real cold and then it's real hot and then it's real cold. And that can change in a day, even in the winter. So this is good news for me. I feel like this is where I'm supposed to be. Okay. One of the things I know that Joe is doing, he's kind of digging into some of, Wim Hof's books, but one of the things that I think he's doing now is taking cold showers. Can you speak to that at all? Just the cold showers, or I think we were at a retreat in Utah and no one did this, but they had a big tub outside for cold water, early morning immersion or something like that. But what is that something a good way to maybe test some things and see how you start to feel?
Yeah, the cold showers actually are helpful in the same way of getting the contrast, because what that does is allows your body to regulate your temperature. So you have internal regulation instead of external regulation. So we always expect that we have to have a heating blanket and a hot shower to regulate our temperature and keep us warm. Whereas we actually have the mechanisms in our body through our autonomic nervous system to regulate our own temperature. In fact, Wim Hof took a group of people that he trained in 4 days. He trained them, and they went in shorts and boots, and they hiked up this mountain in Poland in the middle of winter. And they came down in their no shirts, no shirts at all, just shorts and boots, and it's minus 17 degrees outside. And they hiked up to the top of the mountain, and I don't know what they ate, whatever. And then they came back down. When they came back down, the park rangers were there with their parkas on and all the fur around them and their goggles on, and they're like
That you mean.
100% covered with everything because it was really cold outside. But these guys were out, no problem.
Oh, that's very interesting.
And
This is,
he trained them to do it. So like the cold showers, it gives our ability to regulate our temperature from internal instead of from external.
okay. Very good. Okay, that's interesting. We do have some questions here, so let's go to those. I'm going to do this one here, this most recent one, and then I'll go back up. But how long should you cold shower or cold immerse for? I use 30 seconds. This is from Sir William.
Um, I, 30 seconds is fine. It doesn't require a whole lot. It's simply getting the cold, your skin to be cold, so that you start training your body to regulate temperature from inside instead of always looking to your skin to regulate your temperature. So it doesn't take long. 30 seconds is fine.
I've been seeing a lot of health gurus doing this a lot. And I also was just reading about how a lot of people are really using it to combat stress. And they're finding that it is helping a lot. So,
oh, it works great for stress because one of the problems with stress is we get dysregulation of our heart because of release of adrenaline and all that. So the heart rate, the temperature, our autonomic nervous system can go crazy with a lot of stress. It causes ulcers. It causes a lot of damage to the body all over. And stress doesn't cause it. It just makes it worse, whatever it is. And when you have control, conscious control over that system, you completely can relieve all of the problems that are associated with stress. That's really a good idea.
the body really is amazing. That is what I'm learning the most about in all of these webinars. It's really amazing. Okay, what else? Let's see. Let me scroll back up here. Again, guys, if you have questions, feel free to post those in the chat, or there is a little a place for you to type questions. It probably says Q&A on your side. So, oh, we have a lot of other people joining. Kansas, Louisiana representing here. Let's see. Krish, hello. I remember your name from Maryland. Let's see. Okay. I have type 2 and I inject insulin every day. Does my insulin injection aggravate my condition?
Okay, that's a question. Does the insulin injection aggravate the condition?
Yes.
Okay. We don't know. We can't know until you've had an insulin test. So if you test the insulin and you find that your fasting insulin level is 50, then yes. Because you're making a lot of insulin and you're adding to that insulin resistance by injecting more insulin. But if you do a test and you find your insulin level is 2, then no, you need that insulin. So it really depends on the insulin test. That's why I always test insulin.
Okay, that's good. Let's see. I'm just going to read this. I'm a newly type 2 diabetic. I've only tested my blood sugar for the past week and a half. My last fasting 14-hour blood test showed blood sugar of 133. When I tested home first thing in the morning, I'm getting a blood sugar of 114 to 118. Is the number I'm looking for below 100?
Yes, the answer is yes. You definitely wanted below 100 because all of the fasting blood sugars should ideally between 70 and 90. Below 100 is considered non-diabetic or not at risk, but between 70 and 90 is optimal. But all of those numbers, the 130, 118, 114, those are all sort of in the same range. That's the low 100s. You got to remember that your blood sugar is being controlled on a minute-to-minute basis. It's going up and down and up and down, and it's being regulated by more than just insulin. You have glucagon and a lot of other hormones that are regulating this insulin. If you drop a little bit too low, then your liver starts making a whole bunch of sugars to make up for it. So it's not just what you eat all the time, and it's not just what it happens to be at the moment. But on a fasting specimen, when you have an empty stomach and you're not absorbing any sugar, that should be pretty well regulated at around between 70 and 90.
Okay. Just out of curiosity, what percentage of people now have a type 2 diagnosis? Do you know that? Or are pre-diabetic? I know we've talked about it.
Yeah, I read recently, and I think prediabetes is important too, because usually people can get the problems, the complications of diabetes before they ever get high blood sugar. So I think the diagnosis of type 2 diabetes is really missing the mark, because the beginning of insulin resistance is really the best way to look at it, because that's when you're starting to see the kidney disease, the neuropathy, and the heart disease already long before the blood sugar's too high. So in the United States, the current statistic is around half of the population has either pre-diabetes or has type 2 diabetes.
So, and I ask that too, because I know a lot of people feel very lonely on this journey. And I just want you guys to know that you're not alone. We're here to help. There are many people that are, sending us emails or commenting on our posts, or sending us, having questions. And we want those questions from you, because we want to know what your struggles are, the things you need help with, the questions that you may have. So feel free to send those messages to us. That helps us to know about the topics, to cover on these webinars. If you have loved ones who are struggling or would like some help, and truly the information that we cover is good information for everyone. It's not, just type 2, the foods we talk about eating or the way we talk about eating, that is for everyone. We all have the opportunity to live with good health. And so these webinars are important, and we really want to help you guys on this journey. So again, send us emails or comment here with questions that you have. We are going to try to open this up for questions every week. So it's a great opportunity to come on, ask Dr. Saunders these questions. So we have some more questions. Again, I just want to remind you guys to go to bartonwebinar.com. That is where you will find our past webinars, more information about all of our supplements, our diabetes solution kit. If you don't already have that, is just there have been thousands of people who have been helped by using that. And so it's just a really, really good kit that you want to check out. Let's see. I have a lot more questions here. Let's see, Krish. Type 2 diabetes subjects. Physicians sometimes prescribe some insulin increments to reduce high sugar levels in some patients. There is already copious amounts of insulin in the system, but unable to elicit its action owing to insulin resistance. How would you rationalize this for the so-called insulin administered for glucose control?
Okay, so this is what we were talking about before, how you have two very different diseases that have the same name because they both exhibit high blood sugar. And so they have one symptom that's similar, therefore they're given the same name. But they're completely opposite diseases. And when somebody has insulin resistance and you add more insulin resistance. So someone with insulin resistance is counterproductive to use something like insulin to treat it. And several of the medications that are used for that also cause the pancreas to put out more insulin, which is also counterproductive. So, the important thing to remember about this is that type 2 is too much. Remember, 2 is too much.
Good.
And it's too much of everything. So you don't need more of anything. You need less of everything. You need less insulin, less sugar, less calories, less fat on your body. Everything that is about diabetes, you need less of if you have type 2. So type 2 is too much. So if someone says you need more of this, then they're probably wrong, because really type 2 is too much. And so the treatment is less.
That's good. This is good. This is good for me to remember too. Okay, so we're gonna go through these quickly here because we are almost out of time. Let's see, is there a better approach to treating high morning fasting readings of 170 than in the day after lunch, 115?
Okay, that's a great question. And here we're seeing the problem that we get when we're using sugar as our measure. Remember that type 2 is too much insulin primarily. The sugar is secondary. The high blood sugar comes later after you've had the disease for 10 or 15 years. So if you're only looking at the sugar and trying to manage the sugar, you're way off the mark. The way to understand that is to say, oh, if my blood sugar's too high, it means I'm eating too much. That's all. It's just, remember, type 2 is too much. So whether it's 170 or 115 or 150 or 200 or 300 doesn't make any difference at all, because the treatment for type 2 is the same. All those blood sugars tell you is that you're getting too much. You're eating too much. That's all it tells you.
That's good. Okay, we have a question wondering, let's see, if you can't afford to buy all the stuff I'm having problems with, my feet nerve damage, can I just take that one particular supplement to get started, or do I have to take all of it? The diabetes solution kit would talk about, just different foods and ways to eat, fasting, etc. So maybe just if you can speak a little bit about Nervala.
Okay, so well, let's talk about cost, for example. Okay, so if you take your food budget and you cut it in half, and you eat half as much, then you take that other half of your food budget and get the supplements to repair your nerves, then you'll get the benefits of two worlds. Number one, eating half as much, taking in half as many calories and half as much food will give you an added benefit of improving your type 2 faster, where then you will have an extra $40 a month for Nervala, for example, $50 a month, to be able to repair your nerves as well, because the nerves don't repair by themselves. It doesn't just automatically go away. We were taught in medical school, let's just wait and see till it goes away. And if you go to your endocrinologist, they're always going to say, well, we don't know what to do, just wait and see. No, you have to do something. If you just wait and see, then it doesn't get better. And that's why you're told it can't be healed. But it's just because if you don't know what to do, or you're going to do nothing to wait and see, it's not going to work. So my recommendation is to cut your food budget in half, eat half as much, and then get the supplements so that you can repair your nerves.
And here's what the Nervala looks like. You can go to bartonwebinar.com. I did post the link to that, and you can get more information about that. Okay. All right, guys, we're running out of time. Let's see. Let's do this quickly. Let's see. My doctor will not test for insulin. Where do I get this?
It depends on what state you're in. Most states allow, unless you're in New York, most states allow you to go into a lab and order tests. And now there's online testing. You can look up online and order your own tests, and they have phlebotomists or labs you can go to where you can get your blood draw and get it sent out to a lab. And I know there's one in Texas that will do any test you want. You can get all this testing done without the doctor ordering it.
Awesome. Okay. Is intake of milk thistle herbs safe when a type 2 diabetic subject is already on metformin XL?
Okay, that's a good question. In fact, it's actually a good idea, because metformin, like the implication being that metformin can damage the liver. Milk thistle extract helps to detoxify certain toxins out of the liver. So the milk thistle extract is a great idea for people who have any fatty liver disease, and especially if you have fatty liver and you're taking metformin XL, it's a good idea to take milk thistle.
Okay, here's our final question, you guys. This is coming from Skip. I need to add weight. Do I eat more protein or veggies? I've never had that problem, so I'm not sure how to answer that, Skip. So I'm going to let Dr. Saunders take that one.
Some people do have the problem with adding weight. And usually I have to test them to find out why, because a lot of people with diabetes, if their blood sugar is getting elevated and they're not gaining weight, it's usually not from insulin resistance. It's usually from a lack of insulin. And so when people have a lack of insulin, then they sometimes need to inject extra insulin or take one of the insulin creating drugs like glipizide or glyburide, which sort of trick the pancreas into making more insulin to add to their ability to put on weight. So protein will put on more weight than fat, and sugar will put on more weight than protein. So that's kind of the sugar, and the only reason the sugar works is because it raises insulin levels. But if you have an insulin problem where you're not making enough insulin, then like your pancreas is pooping out or something, then you may need to do something else to increase the insulin in order to put the weight on.
Okay. My doctor told me I was born with only so much insulin. Is that true? I said one more. I said that was the last question, but I had to ask.
The pancreas can put out an amazing amount of insulin if it's functioning properly. But no, there isn't a specific limit to the amount of insulin. Like any hormone, it's a hormone. So like any hormone, there's no limit to the amount of thyroid you can put out. There's no limit to the amount of adrenal you can put out. But some people have a limit. I have someone who had a surgery and had part of her pancreas removed. And so she has, her limit is she can only make about 1/3 of the insulin of the average person because she has half a pancreas. So I don't know why this person would have a limit, but normal people who have a normal functioning pancreas, no, there's no limit.
Okay. All right, you guys, we are going to wrap it up there. This was great. We thank you for all of your questions. Come back next week. If you aren't registered for this, if you're catching us on Facebook, make sure you go to bartonwebinar.com. There's a place to register for this webinar so that you'll get an email each time right before the webinar starts. But they are on Tuesday, same time. We talk about type 2 diabetes. And then some other fun topics we kind of mix in there as well. But we're still thankful for you guys. Again, go and share this on Facebook or share our YouTube video, because we want to help as many people as we can. And we know that you guys have loved ones who want to tackle this as well. So again, thank you so much. Dr. Scott, as always. Dr. Scott's busy. He has to go. He's got lots of work to do. So thanks, Krish. Thanks for hopping on. We will be back next week, you guys. Bye-bye for now.
Bye.